Welcome, everyone. I'm excited to introduce today's topic, iron deficiency. On this first slide, you'll see the title prominently displayed. Over the course of this presentation, we'll explore what iron deficiency is, why it matters, and how it impacts health. We'll also look at causes, symptoms, and potential solutions. So let's get started and dive into understanding this important issue. Let's look at this clinical scenario involving a 24-year-old woman who comes to the clinic with some concerning symptoms. She's been experiencing persistent fatigue and shortness of breath, especially noticeable when climbing stairs. These symptoms suggest she might be dealing with some underlying issue affecting her oxygen delivery or blood health. She also reports heavy menstrual bleeding over the past few months, which is an important detail. Heavy bleeding can lead to significant blood loss, and that often results in anemia. On examination, she appears pale, which is a classic sign of anemia due to reduced red blood cells or hemoglobin. She also has brittle nails and a smooth tongue, which are additional physical signs that can point toward nutritional deficiencies or anemia. This scenario highlights the importance of recognizing the signs and symptoms of anemia, especially in young women, and understanding how factors like heavy menstrual bleeding can contribute. It also underscores the need for a thorough clinical assessment to determine the underlying cause and guide appropriate management. Let's look at this clinical scenario involving a 2-year-old child. The child has been brought in because of irritability and poor appetite, which are common but nonspecific symptoms. What's particularly noteworthy here is that the mother reports the child has been eating chalk and soil, a behavior known as pica. Pica is an eating disorder characterized by the craving and consumption of non-food substances. This behavior can sometimes point us toward nutritional deficiencies, especially iron deficiency anemia, or other underlying issues. Additionally, the child's diet mainly consists of cow's milk with very few solids. Relying heavily on cow's milk at this age can sometimes lead to nutritional gaps, such as iron deficiency, because cow's milk is low in iron and can even cause minor intestinal bleeding, which further worsens iron levels. Connecting these points to the broader theme of our presentation, this scenario highlights how dietary habits and nutritional deficiencies can manifest with symptoms like irritability and poor appetite. It also underscores the importance of thoroughly assessing dietary history and behaviors like pica when evaluating pediatric patients with such symptoms. Let's take a look at clinical scenario 3. Here, we have a 65-year-old man who is 3 months post-gastrectomy. He's reporting feelings of weakness and lightheadedness, which can be quite concerning. When we examine him, we notice pale conjunctiva, indicating pallor. His lab results reveal microcytic hypochromic anemia, which suggests a specific type of anemia often linked to iron deficiency. This makes sense given his recent surgery, as gastrectomy can interfere with iron absorption. Recognizing these signs and lab findings is crucial, as they help us understand the underlying cause of his symptoms and guide appropriate management. This scenario highlights how surgical history can directly impact nutritional absorption and lead to anemia, reinforcing the importance of monitoring at-risk patients closely. Let's start by looking at the definition and core concept of iron deficiency anemia, or IDA. It's actually the most common nutritional deficiency worldwide, which highlights how widespread and significant this issue is. When we talk about IDA, what we mean is that the body isn't getting enough iron to meet its needs. Iron is essential because it's a key component in producing hemoglobin, the molecule in red blood cells that carries oxygen throughout our bodies. So, when iron supply falls short of what the body needs for hemoglobin production, it results in less hemoglobin being made. This means that the blood's ability to deliver oxygen to tissues and organs is compromised. That reduced oxygen delivery can lead to symptoms like fatigue, weakness, and other health problems. Understanding this core concept is crucial because it connects to the broader theme of nutritional health and the importance of adequate iron intake for maintaining overall well-being. Remember, iron deficiency isn't just about anemia. It's about how vital iron is for our body's oxygen transport system and overall vitality. Let's take a closer look at the mechanism overview. Iron plays a crucial role in our bodies, especially when it comes to hemoglobin synthesis. Hemoglobin is the protein in red blood cells that binds oxygen and allows it to be transported throughout the body. Without enough iron, this process is disrupted. When iron levels are deficient, hemoglobin production decreases, which means less oxygen can be carried by the blood. This leads to tissue hypoxia, or simply put, a shortage of oxygen in the tissues. Now, this oxygen deficiency triggers a series of symptoms. These symptoms arise because the tissues aren't getting the oxygen they need to function properly. Our body then tries to compensate for this lack by increasing heart rate or respiratory rate, for example, to deliver more oxygen. Connecting this to the broader theme, understanding this mechanism helps us grasp why iron deficiency anemia causes such widespread effects. It's all about how vital iron is for oxygen transport and how its deficiency can ripple through the entire system, causing noticeable symptoms and health impacts. Let's take a closer look at some common causes of iron deficiency. First, blood loss is a major factor, especially through menstrual bleeding or gastrointestinal bleeding. These losses can deplete iron stores quite rapidly. Next, increased demand occurs during times like pregnancy or rapid growth phases in children and adolescents, where the body needs more iron to support tissue development. On the other hand, decreased intake is also a common cause, often due to poor diet or malnutrition, meaning we're simply not consuming enough iron-rich foods. Lastly, there are situations where absorption is impaired, such as in conditions like celiac disease or after procedures like gastrectomy, which can interfere with how well the body absorbs iron from food. Understanding these causes helps us see why iron deficiency is so prevalent and highlights the importance of addressing these underlying issues in our overall approach to health. Let's take a closer look at some key laboratory findings associated with iron deficiency anemia. First, we often see microcytic hypochromic red cells. This means the red blood cells are smaller than normal and have less hemoglobin, which is characteristic of iron deficiency. Next, serum ferritin levels are particularly important because they tend to decrease early in the process. Ferritin is our stored form of iron, so a drop here is often the first marker indicating iron deficiency. We also see an increase in total iron binding capacity, or TIBC. This happens because, as iron stores diminish, the body tries to compensate by producing more transferrin to maximize iron transport. At the same time, serum iron levels decrease, along with transferrin saturation. This reflects the reduced amount of circulating iron available for red blood cell production. Putting it all together, these lab findings help us confirm iron deficiency anemia and understand how the body responds to iron depletion. Recognizing these markers is crucial in diagnosing and managing this condition effectively. Now let's look at the treatment options for iron deficiency anemia. One of the mainstays is oral iron, which typically comes in forms like ferrous sulfate, ferrous fumarate, or ferrous gluconate. These are usually the first choice because they are effective, convenient, and cost-efficient. However, there are situations where oral iron isn't enough, such as in cases of malabsorption or intolerance. In those cases, we turn to parenteral iron, which is administered via injection or infusion directly into the bloodstream. This approach ensures that the patient receives the necessary iron even if their gut can't absorb it properly. Another important point to consider is the role of adjuncts. For example, vitamin C significantly enhances iron absorption, so recommending vitamin C-rich foods or supplements can improve treatment outcomes. Lastly, we need to identify and treat the underlying cause of the iron loss. Whether it's gastrointestinal bleeding, heavy menstrual periods, or another source, addressing the root cause is essential to prevent recurrence and ensure long-term health. Overall, effective management combines appropriate iron therapy with addressing the underlying issues, making sure patients recover fully and maintain their health. Now, let's talk about some of the adverse effects and contraindications associated with iron therapy. When it comes to oral iron, patients often experience gastrointestinal upset, which can include nausea or stomach discomfort, as well as constipation. Dark stools are also common, which is usually harmless but can be alarming to patients. Additionally, some may notice a metallic taste in their mouth after taking oral iron. On the other hand, parenteral iron, which is given through injections or infusions, has its own set of risks. Hypotension, or a sudden drop in blood pressure, can occur during administration. More seriously, there's also the risk of anaphylaxis, especially with iron dextrin, which is a more traditional form of injectable iron. It's also crucial to remember who should avoid iron therapy altogether. Patients with hemochromatosis, a condition characterized by iron overload, should be cautious because excess iron can worsen their condition. Similarly, those with hemolytic anemia should avoid iron supplementation unless specifically advised by their healthcare provider, as iron overload can be harmful in these cases. Understanding these adverse effects and contraindications helps us ensure that iron therapy is used safely and effectively, aligning with our overall goal of optimizing patient care while minimizing risks. Let's talk about some important clinical pearls when it comes to managing iron therapy. First, did you know that vitamin C actually enhances iron absorption? So, encouraging patients to take their iron supplements with a vitamin C-rich food or drink can really make a difference. On the other hand, there are substances that can interfere with absorption, like antacids, T, and tetracyclines. These should be used cautiously or spaced out from iron therapy to avoid reducing its effectiveness. Lastly, it's crucial to monitor ferritin levels during treatment. Ferritin gives us a good idea of the body's iron stores and helps us assess how well the therapy is working. Keeping these points in mind helps us optimize treatment outcomes for our patients. Let's take a closer look at the Mnemonic Iron Ladies Code, which is a helpful way to remember the different causes of iron deficiency anemia. Starting with I, intake low. This could be due to poor diet or conditions like pica, where individuals crave non-food substances, which can lead to inadequate iron intake. Moving to R, red loss. This is often related to blood loss, such as heavy menstrual periods or gastrointestinal bleeding, both of which can deplete iron stores over time. Next is O, overuse. This refers to increased iron demand during periods like growth spurts in children or pregnancy, where the body needs more iron to support increased blood volume and tissue development. Finally, N, no absorption. Certain conditions, such as celiac disease or after gastrectomy surgeries, impair the intestine's ability to absorb iron properly. Recognizing these causes helps us approach diagnosis and management more effectively. This mnemonic ties into our overall goal of understanding the various pathways leading to iron deficiency, so we can identify and treat it appropriately. Let's take a closer look at the mnemonic FITS low, which helps us remember the key lab findings in iron deficiency anemia. F stands for ferritin, and in this condition, ferritin levels are decreased, indicating low iron stores. I is for iron itself, which is also decreased, reflecting the deficiency. T represents transferrin saturation, and this is reduced as well, showing that less iron is available for transport. Lastly, S stands for TIBC, or total iron binding capacity, which is increased in iron deficiency. These lab findings collectively paint a clear picture of iron deficiency anemia. Recognizing these patterns helps us confirm the diagnosis and differentiate it from other anemias. Remember, the overall theme here is understanding the body's iron status. Ferritin and iron drop, transferrin saturation decreases, but TIBC rises as the body tries to compensate. This mnemonic really encapsulates the typical lab profile in iron deficiency, making it easier to recall during clinical assessment. Let's wrap up with some important exam and practice notes. When it comes to iron deficiency anemia, it's commonly tested as a microcytic hypochromic anemia, which means the red blood cells are smaller and paler than normal. Typically, you'll see low ferritin levels, indicating depleted iron stores, and high TIBC, which shows the blood's increased capacity to bind iron when iron is deficient. Now, in adult men and postmenopausal women, it's particularly important to investigate for chronic gastrointestinal blood loss as the underlying cause. This is because, unlike premenopausal women who may lose iron through menstruation, men and postmenopausal women aren't losing iron regularly, so any deficiency often points to something like bleeding in the GI tract. Understanding these key points helps us not only in identifying iron deficiency anemia, but also in guiding us toward the correct underlying causes, which is essential for effective management. This ties into the overall theme of recognizing and investigating anemia thoroughly to provide targeted treatment.